That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B or C which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1. Extract 1. Questions 31 to 36. You hear an interview with a doctor. You now have 90 seconds to read questions 31 to 36.
Today we're talking to Dr. Emily Lee, a hematologist and expert in anemia in the USA. Dr. Lee, can you explain what anemia is and what causes it?
Anemia is a condition where there is a deficiency of red blood cells or hemoglobin in the blood, which can lead to a reduced ability to carry oxygen throughout the body. It can be caused by a variety of factors such as iron deficiency, vitamin deficiency, blood loss, or a chronic illness.
How is anemia diagnosed and what are the symptoms?
Symptoms of anemia can vary depending on the individual, but typically include fatigue, weakness, pale skin, shortness of breath, and dizziness. Diagnosis is typically made through a combination of physical exams, medical history, and diagnostic tests such as blood tests or a bone marrow biopsy.
What treatments are available for anemia?
Treatment for anemia typically involves addressing the underlying cause of the condition. This may involve dietary changes, such as increasing intake of iron or vitamin-rich foods, or treating any underlying conditions that may be contributing to the anemia. In some cases, blood transfusions or medication may be necessary to help manage the symptoms of anemia.
Are there any long-term complications associated with anemia?
If left untreated, anemia can lead to complications such as heart failure, arrhythmias, or damage to organs due to a lack of oxygen. It's important to diagnose and treat anemia as early as possible to prevent these long-term complications.
What can people do to prevent anemia?
Maintaining a healthy diet and getting regular checkups with a healthcare provider can help prevent anemia. For individuals who are at risk for anemia, such as those with a history of blood loss or those with chronic illnesses, it's important to monitor their condition closely and seek medical attention if symptoms arise.
Can you share a case study of someone who has experienced anemia?
Yes, I recently saw a patient, let's call her Sarah, who presented with fatigue and weakness. After running some tests, we diagnosed her with iron deficiency anemia. We started her on an iron-rich diet and prescribed iron supplements. After a few weeks, her symptoms improved significantly and her blood work showed an increase in her red blood cell count.
What advice do you have for individuals who may be at risk for anemia?
If you are experiencing symptoms of anemia, such as fatigue or weakness, it's important to seek medical attention and get tested for the condition. Maintaining a healthy diet and getting regular checkups with a healthcare provider can help prevent anemia. For individuals who are at risk for anemia, such as those with a history of blood loss or chronic illnesses, it's important to monitor their condition closely and seek medical attention if symptoms arise.
Thank you. Dr. Lee, for sharing your expertise on anemia. Can you tell us more about the different types of anemia?
Sure, there are several types of anemia, and they can be classified based on the underlying cause. Iron deficiency anemia is the most common type and occurs when the body doesn't have enough iron to produce red blood cells. Another type is vitamin deficiency anemia, which can be caused by a deficiency in vitamin B12 or folate. Aplastic anemia is a rare type that occurs when the bone marrow doesn't produce enough red blood cells. Hemolytic anemia is another type, which occurs when red blood cells are destroyed at a faster rate than they are produced.
How is each type of anemia treated differently?
Treatment for anemia depends on the underlying cause. Iron deficiency anemia is treated with iron supplements and increasing iron-rich foods in the diet. Vitamin deficiency anemia is treated by increasing intake of vitamin B12 or folate through supplements or dietary changes. Aplastic anemia may require a bone marrow transplant or immunosuppressive therapy. Hemolytic anemia can be treated with medications to suppress the immune system or through blood transfusions.
Can anemia be hereditary or genetic?
Yes, some types of anemia can be hereditary or genetic. For example, sickle cell anemia is an inherited condition where the red blood cells are misshapen and can't carry oxygen properly. Thalassemia is another inherited condition where the body doesn't produce enough hemoglobin. It's important for individuals with a family history of anemia to inform their healthcare provider and get tested for any potential genetic risks.
Are there any lifestyle factors that can contribute to anemia?
Yes, certain lifestyle factors can increase the risk of developing anemia. A diet low in iron or vitamins can contribute to anemia, as can excessive alcohol consumption, smoking, and chronic illnesses such as kidney disease. Individuals who have undergone surgery or experienced significant blood loss may also be at increased risk of developing anemia.
How can someone maintain a healthy diet to prevent anemia?
A healthy diet that includes foods rich in iron, vitamin B12, and folate can help prevent anemia. Good sources of iron include red meat, poultry, fish, beans, and leafy green vegetables. Foods high in vitamin B12 include meat, fish, and dairy products, while folate is found in leafy green vegetables, beans, and fortified grains. It's important to talk to a healthcare provider about individual dietary needs and any potential risks for anemia.
Thank you, Dr. Lee, for sharing your knowledge about anemia and its prevention and treatment.
You're welcome. Thank you for having me. It's important to raise awareness about anemia and encourage individuals to seek medical attention if they suspect they may be experiencing symptoms of the condition.
Now look at Extract 2. Extract 2. Questions 37 to 42. You hear a talk given by a healthcare professional. You now have 90 seconds to read questions 37 to 42.
Ladies and gentlemen, distinguished guests, and fellow healthcare professionals, it is an honor to stand before you today to discuss a subject close to my heart: idiopathic pulmonary fibrosis, IPF. IPF is a chronic and progressive lung disease that results from the formation and accumulation of scar tissue, fibrosis, in the lungs with no known cause. The word idiopathic means that the cause of the disease is unknown. Once considered rare, IPF now affects millions of people worldwide, including up to 132,000 in the United States alone, with over 50,000 new cases diagnosed each year. The early symptoms of IPF are often nonspecific and can easily be mistaken for symptoms of other respiratory conditions. These symptoms include a persistent dry cough, shortness of breath, and fatigue, which may get worse over time. Since the symptoms are not specific to IPF, the diagnosis is often delayed, and the condition worsens before the patient receives the proper diagnosis. The diagnosis of IPF is based on various tests, including a physical examination, lung function tests, and imaging tests such as CT scans and X-rays. A diagnosis often involves conducting a thorough review of the patient's medical history, including exposure to certain chemicals, dust, and pollutants that could be relevant to the disease. The most significant challenge with IPF is that there is no known cure, and the progression of the disease can be rapid, leading to a decline in overall lung function and quality of life. While the average survival rate for patients with IPF ranges between 3 and 5 years, some people live much longer, while others may survive only a few years. Hence, early diagnosis and treatment are critical. Several treatment strategies have been approved to help manage IPF, including drugs that focus on slowing down the progression of the disease or relieving the symptoms. Pulmonary rehabilitation, oxygen therapy, and lung transplant are also treatment options for patients with advanced stage IPF, although lung transplantation is not always feasible. The management of IPF also involves regular monitoring with lung function tests and imaging scans. It should involve a multidisciplinary team, which should include pulmonologists, respiratory therapists, physical therapists, social workers, and nutritionists. This team approach allows for better symptom management, leading to an improvement in overall quality of life. Patients also play a critical role in the management of IPF. With the guidance of their healthcare provider, patients must make lifestyle changes to help manage their condition, including quitting smoking, avoiding polluted or dusty environments, and staying physically active, which can help improve overall lung function. There are still many gaps in our understanding of IPF, primarily because the cause of the disease is still unknown. Although research on IPF is ongoing, we still have much to learn before we can fully understand this disease and develop a cure for it. As healthcare professionals, it is essential to recognize the impact of IPF on our patients and their families. As we work towards better therapies, one must remember the importance of empathy and communication in managing this condition. To illustrate the impact of IPF, let me recount a case study of a patient I recently treated. Miss X was a 62-year-old non-smoker who presented to our clinic with a persistent dry cough and shortness of breath for over a year. She had earlier visited several providers and was misdiagnosed with asthma, leading to poor symptom control. A series of lung function tests, imaging studies, and a thorough medical history revealed interstitial lung disease, ILD, with a diagnosis of IPF. Miss X's condition had progressed, and she had well-established fibrosis, limiting her lung function to critical levels, leading to a decline in her overall quality of life. She was started on antifibrotic therapy, and the pulmonary rehabilitation program was initiated, followed by surveillance of the disease with routine monitoring techniques. Her lung function improved to some extent with therapy, but she required oxygen supplementation to support her respiratory function. Despite ongoing management, her overall outlook remained guarded due to her established fibrosis. Recent research advances in understanding IPF pathology have identified various genetic factors that could predispose individuals to the development of IPF. Interleukin-11, IL-11, also showed promise in slowing down the fibrosis process in IPF. Future directions include the identification of genetic markers and personalized treatment strategies. Therapy with IL-11 needs further examination in Phase 3 trials to evaluate its impact on IPF disease progression. With ongoing research and clinical trials, one hopes that a cure for IPF can be discovered soon. In conclusion, idiopathic pulmonary fibrosis is a chronic and progressive disease that causes irreversible damage to our lungs. Early diagnosis and management through a multidisciplinary team and a close follow-up plan can help manage the disease and prevent further progression. Healthcare providers shall continue to strive towards identifying genetic markers and exploring personalized treatment strategies to help our patients. Let us continue to work together to offer supportive care, education, and hope to our patients and their families living with IPF. Thank you.
That is the end of Part C. You now have 2 minutes to check your answers. That is the